Now I would like to ask Mrs. Sharon Slater, head of Family Watch International, to have her presentation. Just to remind you, I was introducing Mrs. Slater, but I would like to do it one more time. Mrs. Slater is the head, as I said, of Family Watch International, which is one of the most important, most accomplished non-governmental organization that is consolidating like-minded movements, and I think that we all learned from you, from your organization, a lot. So thank you so much for accepting our invitation.
Thank you so much. It's an honor to be here. I was asked to talk about abortion facts, understanding the negative impact of abortion on women. And I'm also going to talk about the impact on girls. What is the impact of abortion on women and girls? We'll talk about the negative physical impacts first. Over 30% of American women, according to the Medical Science Monitor, suffer health complications after undergoing an abortion. Now, I want you to think about this statistic because this comes from the United States, which is a very developed country and has an excellent health system. So imagine what the complications might be for a developing country where women seek to procure an abortion. Here's just a partial list of some of the negative physical impacts, including accidental tearing of uterine artery, infection, heavy bleeding that could require a blood transfusion, scarring of the uterine wall, uterine perforation, breast cancer, miscarriage, infertility, subsequent tubal pregnancies, embolisms, sterility, and death. This comes from the Obstetrics and Gynecology Journal, which found that about 10% of women who have an abortion experience complications immediately, including cervical injury and perforation of the uterus. Leading causes of death during the week after an abortion include hemorrhage, infection, embolism, anesthesia complications, and undiagnosed ectopic pregnancies. This article, Risk Factors for Triple-Negative Breast Cancer in Women Under the Age of 45 Years, states that the risk of breast cancer was 40% higher in women who had an induced abortion as compared with women who did not. Now, when I first started about 20 years ago in the pro-life movement, and I heard that abortion can cause an increase in breast cancer, I really thought that sounded a little bit absurd. I thought, surely, we're going a little too far in making this claim. But in the 20 years that I've been advocating for the protection of life, I've learned a little bit more about this and why it is absolutely true. This article, The Pregnancy Characteristics and Subsequent Breast Cancer Risk Among Young Women, states that pregnancy, and especially first pregnancy, appears to represent a critical window in determining future breast cancer risk. It goes on to state a significant elevation of breast cancer risk was associated with a history of induced abortion, but not spontaneous abortion. What this is saying is that this increase for breast cancer does not occur when there is a natural miscarriage. It only happens when there is an induced abortion. And here's the explanation of why this happens. The mammary cells, or the breast cells, are thought to proliferate during the first and second trimester of pregnancy, and they don't differentiate and become completely mature until the third trimester when they're preparing for breastfeeding and mothering. So when these breast cells during the first trimester are starting to change, they start to also become vulnerable and susceptible because they're not completely mature, but they're growing and the metabolic activity is increasing inside them. Moreover, increased breast hyperplasia followed by termination of pregnancy prior to full differentiation of these mammary stem cells may increase the breast's susceptibility to neoplasia. Now, this doctor explained it also in more simple terms. Two aspects of induced abortion may increase cancer risk. First, abortion typically is done in a time frame after the estrogen spike, which can stimulate immature cells to become more metabolically active and increase their number. So we're talking about the first trimester of abortion. The estrogen spike in the body shoots up the roof to start preparing the breasts. Now, I was diagnosed with stage 1A breast cancer at the beginning of this year. Unfortunately, we caught it really early, but when they tested my breast cancer and before they removed it, they said it was called estrogen positive. That means that estrogen stimulates the breast cancer to grow more and more, which is what's happening during the first trimester for girls and women, and all women and girls. That estrogen spikes up. And so these cells start growing, and if they don't differentiate and actually become mature, which happens later on in the pregnancy, if the pregnancy is arrested through induced abortion, then that makes them more susceptible to that breast cancer. So he says, second, early termination of the pregnancy delays breast maturation, which typically occurs as the pregnancy progresses. These effects are present regardless of whether the abortion is induced surgically or chemically. Again, this does not happen with a natural miscarriage. For some reason, the body is able to handle that change and not increase the risk in those cells for breast cancer. Now, currently, I am supposed to take an estrogen blocking pill every day for 5 years because that estrogen could cause me to have cancer again or to cause any cell in my body to cause that cancer to grow. Continuing with the negative physical impact of abortion on women, abortion increases self-destructive lifestyles practices, increasing the risk of promiscuity, smoking, drug abuse, and eating disorders, which all put women at an increased risk for other health problems. And I've talked to many post-abortive women who have given their testimonies about how they have been at increased risk and experienced many of these things. In fact, there's an organization based in the United States called Silent No More, and they have collected thousands of testimonies from thousands of women across the globe, and you can go to their website and look up testimonies from your specific country, and you can even decide what kind of topics of testimony that you would like to hear from them on their website, and I encourage you to go there. And this is just one of many groups of women who have started organizations to tell the world that abortion is harmful. And then this physical impact comes from the Journal of Obstetrics and Gynecology from Canada. It found that abortion can cause long-term and sometimes permanent damage to reproductive organs that can put future pregnancies at risk. After an abortion, women are more likely to experience ectopic pregnancies, infertility, hysterectomies, stillbirths, miscarriages, and premature births than women who have not had abortions. After abortion, for subsequent pregnancies, there is a 7 to 15-fold increase in placenta previa, a life-threatening condition for the mother and baby that increases the risk of birth defects, stillbirth, and excessive bleeding during labor. This article, The History of Induced Abortion as a Risk Factor for Preterm Birth in European Countries, states, previous induced abortions were significantly associated with preterm delivery, and the risk of preterm birth increased with the number of abortions. Further, between 1989 and 1993, Poland's induced abortion rate decreased 98%, due to a new restrictive abortion law. Then the Demographic Yearbook of Poland reports that between 1995 and 1997, the rate of extreme preterm births dropped by 21% because there were less abortions, so there were less preterm births. Now let's move on to the negative psychological impact of abortion on women. Here's just a partial list that includes anger, depression, anniversary grief, sexual dysfunction, eating disorders, alcohol and drug abuse, and suicide. So this is from the British Journal of Psychiatry, and they found through a meta-analysis covering 14 years of research that women with an abortion history experienced an 81% increased risk for mental health problems, including anxiety disorders, depression, substance abuse, and suicide behaviors. And from the Journal of Anxiety Disorders, they found through a wide range of studies that show that women who have an abortion experience psychological anxiety, Women with no previous history of anxiety were 30% more likely to show symptoms of generalized anxiety. Sleeping disorders. Women were nearly twice as likely to experience sleep disorders after an abortion. Eating disorders. After abortion, 39% reported eating disorders. Substance abuse. Women had a 5 times higher rate of drug and alcohol abuse. Sexual dysfunction. 30 to 50% of post-abortive women report experiencing sexual dysfunctions, such as promiscuity, loss of pleasure from intercourse, increased pain, and aversion to sex and/or men. And a study in the Canadian Journal of Psychiatry found that women who had abortions also had a 59% increase for suicidal thoughts, 61% increased risk for mood disorders, 61% increase for social anxiety disorders, a 261% increase for alcohol abuse, and a 280% increased risk for substance use disorder. Now let's focus on girls, teenage girls, the negative physical impact of abortion on these girls. Suicide. If a teenage girl has an abortion in the last 6 months, she is 6 times more likely to attempt suicide than teenagers who have not had an abortion. Teenage girls who have had an abortion are 4 times more likely to commit suicide than adult women who abort. And then from this Journal of Youth and Adolescence, after an abortion, teen girls are 3 times more likely to report subsequent sleeping disorders and are trouble sleeping, and are 9 times more likely to report using marijuana. So what are the negative psychological impacts of abortion on girls? Compared to teens in general, teenage girls who have an abortion are nearly 3 times more likely to be admitted to a mental health hospital. Teen girls who abort are twice as likely as their peers to abuse alcohol or cocaine, was found in one study. And another study found that teen girls who abort experience increased rates of depression, anxiety disorder, suicidal ideation, alcohol dependence, illicit drug dependence, nicotine dependence, and cannabis abuse. This is from the Journal of Adolescence. Compared to older abortion patients, teen girls who have abortions are more likely to have severe nightmares and score higher on measurements of antisocial traits, paranoia, psychotic delusions, and drug abuse, and have more problems later regarding sexuality and parenting. From the American Journal of Public Health, teen girls who have aborted a baby are 4 times more likely to have a repeat abortion. And after an abortion, teen girls are likely to become pregnant again within the next few years. This is from the Canadian Medical Association Journal. And with the remaining time, we'll just briefly treat this question: is abortion safer than childbirth? From the Post-Abortion Review, they found that compared to women who carried to term, women who had an abortion the year prior to their deaths were 60% more likely to die from natural causes, 7 times more likely to die from suicide, 4 times more likely to die of injuries related to accidents, 14 times more likely to die from homicide. Now here's a chart that this is measuring these statistics in Finland from the British Journal of Obstetrics and Gynecology, and it shows the suicide rate between 2001 to 2012 in Finland, comparing a woman or a girl who is not pregnant to a woman or a girl who is pregnant to those that had abortions. And you can see that those that had abortions have an extremely high suicide rate compared to the other categories. This is again from Finland in the British Journal of Obstetrics and Gynecology, and this shows the mortality rate, the death rate of women. Those that are not pregnant is the first bar, those that are pregnant, the second bar, and those who have had abortion is the third bar. Again, those that had abortion have a much higher mortality rate. They also looked at the decrease of the mortality rate over time, because mortality rates in Finland and also in many places have been decreasing. And they looked at those who were not pregnant. The mortality rate for them decreased 18%. Those who were pregnant, it actually decreased way more, to 27% decrease, because we're now having much better, medical technology and knowledge in the medical field. But look at the abortion statistic. There was only a 10% decrease in mortality rates for women who had abortion compared to the other decreases. And then this is from the Medical Science Monitor. Compared to women who delivered a baby, women who aborted were 65% more likely to experience long-term clinical depression. Now, I'm going to end with a personal story. When I was pregnant with my fourth child, I started to have high blood pressure, and they rushed me to the hospital for eclampsia. And I actually started to go into a seizure. And they told me, "Ma'am, we're going to have to deliver the baby in order to save your life. Your life is in danger." They told me they could wait for 45 minutes for my husband to arrive. At least they hoped they could, and they would watch and see, but they were able to, and he was able to get there. And they delivered my baby. She was about 5 weeks early. And she was rushed off to the NICU, and I didn't get to see her for a few days because she had some problems. I didn't get to bring her home from the hospital for a few weeks. She was about 4 pounds, just barely over 4 pounds when she was born, but she survived because they worked to save both the mother and the child. This is my daughter Jessica now with her husband, and this is my grandbaby Graham. And they're alive today, again, because the doctors worked to save both the mother and child. Often we hear that we need to legalize abortion or perform abortions to save the life of the mother. Well, indeed, you may need to deliver the baby. You may need to remove the baby from the mother. And if the baby's not viable, in some cases, the baby may die, which is very sad and very tragic. But there is never a medical instance, I've talked to many doctors about this, where you actually have to intentionally kill the baby before you deliver it. Deliver, a saline poison to kill it, or inject some chemical in their heart to cause them a heart attack, or to dismember the baby limb by limb, which are methods of abortion that have been used commonly. That's never necessary to save the life of the mother. So I'll just end with this. Women and girls deserve better than abortion, and we should always work to save both the mother and the child. Thank you.